Welcome to the Health Impact Hub's podcast, The Hub. This is a space where we highlight the voices of those shaping the future of health, not just in clinics and hospitals, but across communities, classrooms, and policy spaces. Each episode, we talk with leaders working at the intersection of medicine, public health, and policy to tackle some of the most pressing issues of our time, whether that's through advocacy, innovation, or grassroots action. Welcome to The Hub. Dr. Richard Pan is a pediatrician, educator, health services researcher, and former state senator and Assemblymember representing the Sacramento region. He's a volunteer physician at the Sacramento County Primary Care Clinic, caring for Medi-Cal and uninsured children and youth. In the California legislature, he served respectively as chair of the Senate and Assembly Committees on Health. In addition, he was chair of the Asian American Pacific Islander Legislative Caucus. He led California's implementation of the Affordable Care Act and advocated for legislation to increase vaccination rates, expand newborn screening, prevent sexually transmitted diseases, enable gun violence research, and improve pandemic preparedness. Before his governmental work, he was professor at the University of California, Davis, and director of the Pediatric Residency Program, where he created communities and health professionals together, a nationally recognized service learning curriculum. He was co-founder and chair of Healthy Kids, Healthy Future, securing health coverage for over 65,000 California children, and he created the Sacramento County Health Authority to provide local oversight of Medi-Cal plans. He has a BA in biophysics from Johns Hopkins University, an MD from the University of Pittsburgh, and an MPH from Harvard University. Dr. Pan is running for Congress because Washington could use a little good medicine. Thank you for being here, Dr. Pan. Dr. Pan, you've had a remarkable journey when it comes to practicing as a pediatrician and also as a policymaker. We would love to hear more about your path, talking about what initially inspired you to pursue medicine, how that kind of unfolded into ultimately taking that leap into public service.
Sure. Well, thank you for having me on your podcast. I'm certainly very excited to talk to you about my journey into policymaking. So I'm a child of immigrants. So what that means is that when I was growing up, I did not see anyone who looked like me or my family in elected office or frankly in many leadership positions in whatever sector we're talking about. And so was never thinking about it ever being elected office in my life because I didn't think anyone like us would ever be elected, right? We just didn't see examples. And as I was growing up, one of the things I, of course, did become interested in is medicine. And there were a couple of reasons for that. One was that when I was in third grade, I read a book about blood and thought it was really cool about white blood cells fighting infection. I thought, oh, who gets to study that? Oh, doctors do. So I'm gonna be a doctor. I also did have a physician, my grandfather as well. So it was another example. But those are things that drove a very early interest in medicine that stayed with me throughout the rest of my life. Now, when I was pursuing medicine through college and then into medical school, my career goals were initially to what I call it discover the next great cure, right? So I was a biophysics major in college at Johns Hopkins. I worked in the lab, studied gene expression, right, histone structures and so forth. And so that was what my career goal would be. But then what happened is that the lab research project I was working on, we got beat out by another lab team over at UPenn, actually a grad student at UPenn. I shouldn't feel bad because I was an undergraduate, got beat out by a grad student. And so I had to find a new project because they had gotten to the paper first. And so I found this research position over at a place called the Center for Hospital Finance and Management in the School of Public Health at Johns Hopkins. And it turned out that was like a think tank, health policy think tank. It was led by a health economist, Dr. Gerard Anderson. There were lawyers and doctors and economists there. And my job was to help do research on a book they were writing on the history of academic health centers that was being funded by the Commonwealth Foundation. But being in this kind of environment, like, oh, well, here's a different set of things around medicine. So I spent several years actually working with this group. And then off to medical school, I went and actually back to the lab in some ways as well. And then what happened was between my second and third year, I actually got an opportunity to either work at NIH or with the National Health Service Corps. So that's when we used to have time off between the second and third years. I think generally most medical schools don't have that anymore. But back then, yes. And actually, through the advice of my Dean of Student Affairs, actually turned down NIH, which everyone else said I should go to, right? After all, look great on the resume for my applications to a residency, and ended up going to York, Pennsylvania, where I learned a lot about community health. And so I like to say my career journey went from the micro to the macro, from like little tiny things like genes to, oh, society and communities and how they influence health. And so that just continued to expand during my career in medicine. So in my residency program, I actually, when I was chief resident, created a community health rotation. As a fellow, I actually worked on looking at what are different types of programs to get doctors out in the community so they can learn about social determinants of health and so forth. And that actually drew the attention of UC Davis, who wanted someone to basically develop their child advocacy program. And so that's how I ended up moving to Sacramento, California to be a faculty member at UC Davis, where eventually, was an associate program director, then program director. So, throughout this journey, wasn't thinking about elected office, but also started to recognize how important, of course, government is in shaping the social determinants of health. So through my involvement through the medical societies and residency at the Massachusetts Medical Society, and then later the California Medical Association as well, I actually got more involved in sort of the legislative process, right? I was on the legislative committees of both organizations, eventually becoming chair of the Council on Legislation at CMA, because we knew that government policy, government decisions, not just at the state level or the national level, but even at the local level, actually have tremendous influence on those social determinants. In fact, I served on the county commission, called the First Five Commission as well. And I also worked with a lot of not-for-profit groups like the United Way and others to create programs for children. In some senses, it was stimulated by the fact that here I am teaching residents about social determinants. And of course, a natural question for any learner is, oh, professor, doctor, or teacher, how do you do what you're talking about, right? So of course I had the model while I was teaching. So of course I got, was involved in a lot of different community organizations and trying to shape those social determinants, right? To help children. And then the Great Recession hit. And when the Great Recession hit, actually, for example, a lot of the programs I was working on basically started to lose funding because of the budget problems. For example, I started not-for-profit to get children healthcare coverage, 65,000 children healthcare coverage across 5 counties. And we were supported by the First Five Commission, which I sat on, and Kaiser Permanente, and several foundations and so forth provided the funding. The Medical Society actually helped kick off the initial study. And unfortunately, those foundations, when the stock market collapsed, right, started running out of funds for that. And so eventually we actually had to shut it down during the Great Recession after, I don't know, almost a decade of operation, right? And so certainly that was particularly frustrating when the Great Recession hit. And then, of course, I was also the medical consultant for the school district and saw how the school funding cuts affected our ability to provide help to children, particularly with like behavioral learning problems, which was my clinical focus as well. I didn't just want to see patients in my clinic about these things. I actually went and worked with the school district and became the medical consultant and other things as well. So finally got to the point in time where I just said to myself, look, even though I've never thought about running for elected office because I never thought I'd be able to get elected because things were a little different in California and so forth. And there were certainly more people who looked more like me who they actually were in office. I would also mention that, Barack Obama's election certainly sent a message that actually elected office was open to more people. Let's just put it that way as well, when he achieved the presidency. So I think those types of things made me think like, well, what I finally said to myself is when we couldn't pass the budget on time and clinics literally ran out of cash to pay their staff, that if I wasn't willing to run, how can I complain about the legislators who were there who couldn't get things done, right? So I decided to run in the 2010 election. And I admit that when I first started, most people thought I had no chance of winning, never held elected office before. I was a Democrat in the safe Republican seat, so wrong party, no experience. But in the end, I won. I've talked to voters and they were frustrated about the fact that the government wasn't working for them, right? And so that's how I ended up in the legislature. And in my time in the state assembly for 2 terms, 4 years, and then the state senate for years, I think we tackled a lot of different problems. I would mention that the uninsured rate when I first came into office was approximately almost 18%, and had been that way in the upper teens for probably several decades. And when I left office, we got down to 6.5%. So that was through implementation of the ACA, but also additional state policies that we passed, right? I would also mention that our vaccination rates actually increased as well. I'm kind of known for my vaccination policies, but we had a large outbreak actually of pertussis right before I got into office, where several infants died, and then of course the measles outbreak in 2015 that started in Disneyland were the reasons for my bills to actually eliminate non-medical exemptions. In fact, I do tell people that if there aren't any outbreaks, you don't see me doing vaccine bills. So stop the outbreaks. We don't need new vaccine. So, but if you're going to have outbreaks, then we got to do something about it. We have to keep kids safe. And a whole variety of other things, including increased funding for public health, expansion of youth mental health, actually public health, including gun violence research, STD or STI preventions, and so forth. So those are all different type of policies I worked on in the legislature as well. And then I was termed out in 2022. I'm now teaching at UC Davis health policy. I think they think I know something about it. I spent 12 years doing it in the state. And so that's what I teach. But I continue to be involved in policymaking through my appointment on the Office of Healthcare Affordability for the state of California, as well as actually the County Health Authority as well.
Amazing. And I definitely want to thank you for also being kind of that idol, if you want to say, and a good source of representation of not only people from immigrant family backgrounds in office, but also physicians in office. So glad to see more of that coming. And I know you've mentioned a lot of these accomplishments, and I wanted to ask you which one you're most proud of, why, and then also how your practice as a physician helped come up with these ideas and really taking stuff from the grassroots and patient experiences and stories that you've learned from and how you've been able to bring them to the greater stage.
Well, there's a lot of things I'm proud of, big and small. Some don't make the news. I'll give you one example of something that doesn't really make the news. So, for example, in California, if you were on disability payments called SSI, you actually couldn't get CalFresh or food stamps, right? You can get nutrition assistance because of some agreement made back in the 70s, which said that in exchange for $5 or more a month in your SSI, you would not, or Social Security, disability payments, you would not be able to get the food stamps. Now, the problem is that you can imagine people who are disabled and such low income that they're getting this, they really can't afford food. And in fact, during recessions, what happens is that the value of the food stamps is much higher than the increase that they got in the SSI. And everyone recognized it was a problem, right? I mean, I was in office in 2010, and this has been going on for decades, and everyone says, "Oh yeah, we need to fix this." And actually, and yet, hasn't it been fixed? And so finally, when I became the budget chair for Health and Human Services, I said, "We are going to fix this," and was able to finally, I guess, everyone said, "Yes, we need to do it," but finally say, "No, we're not going to stop talking about. We're actually going to do it," and we actually accomplished it. And so during my time, actually, now Californians who are on disability payments because they're disabled are also able to get nutrition assistance so they don't go hungry as well. And so that's one example of something I'm proud of that doesn't really make the press. I think there's a little press coverage about that, but it's still very important to this population. I do think the thing I'm most proud of is actually the increase, actually, I would say the increase in number of people who actually have health care coverage, right? So my vaccination work is the one I'm most well known for and probably got the most publicity. But as I mentioned earlier, reducing the uninsured rate by over 2/3 was a challenging thing to do because after all, it had been that at the higher rate for decades. It wasn't like it was just a spike to 18% because of the Great Recession. It was a little higher than normal, but essentially it was in the upper teens. And we still have a ways to go, right? We're down to 6.5%. We need to get it lower, but the fact that we were able to bring it so far down in the time I was in the legislature, I think something I'm very proud of because after all, before I got to the legislature, that's why I started a not-for-profit to get children health care coverage. And actually children's uninsured rates are even lower, right? So we were able to do more for children as well. So that's actually frankly what I'm most proud of. I know alone, we still need to do more, but I think we got some things done. So
That's amazing. And kind of going based off of that, so a lot of your career has been spent supporting our communities in California through health policy and advocating for that evidence-based reform. So what inspired you to bring that work to the federal level, and what are the key issues or values driving your congressional campaign?
Yes. So I am running for Congress, and the same way that I decided to run for the state legislature because of the dysfunction that was happening, the state government. The Economist actually had a headline, I think, on a cover. It said California is ungovernable, right? I think we showed that that's not the case. Not only did we, of course, get more people healthcare coverage, we actually got the budget stabilized, right? We went from a $28 billion deficit to a $30 billion reserve during my time there. And we grew the economy. So California's economy grew from, I think, eighth largest to fourth largest during my 12 years there. But now we're seeing at the federal government a unfortunate situation where actually they passed the bill, HR 1, sometimes known as the OBBB, which is going to slash Medicaid coverage for people. We're going to see millions of Americans, millions of Californians lose their health care coverage because of the cuts to Medicaid. And on top of that, due to lack of action by the Congress so far, we're going to have millions more lose their private health insurance because they're going to eliminate the subsidies that were passed in the Inflation Reduction Act. I should mention in California, during the first Trump administration, I worked on policies to, first of all, we actually gave state subsidies to help get more middle class people health insurance through Covered California as part of our effort, again, to reduce the number of uninsured. But in addition to that, we also worked on policies that actually stabilize the actual cost of health insurance. So it's not just about saying, oh, well, let's give people subsidies to help them buy health insurance, which is important, but let's try to limit the actual cost of health insurance itself. And in fact, thanks to those policies, for 2 years in a row, Covered California insurance rates on average grew less than 1%. That's less than inflation. That was less than the GDP growth. In other words, workers who are on Covered California, people in Covered California were able to actually get ahead because their health insurance costs were actually less than what their wage increases were and what inflation was. All right. That's what kind of action we need to see at the federal government, not slash and burn and let's double, literally probably more than double health insurance premiums for middle class families who can't afford to pay that. So we're going to have millions of people lose their health insurance. And the thing we have to remember, right, is that, okay, fine, they'll lose their health insurance, but what does that really mean? When you lose your health insurance, your health problems don't go away. Doesn't mean you stop getting sick, you don't get injured, you don't need health care. It just means that you are less able to pay for it. And when you can't pay for it, who does pay for it? All the rest of us who actually have insurance. It drives up our insurance rates too. In fact, actually, when they were debating health reform before I got in the legislature, when Arnold Schwarzenegger was governor, they actually calculated that everybody who had private insurance, probably $1,000 per year of your private insurance was to cover people who didn't have health insurance because you had to cross subsidize them to keep the hospitals and the doctors and so forth open. So all you did is you shifted that and made it more expensive for everyone else. So, we should be working to try to make healthcare coverage, but ultimately healthcare, and that's why I'm in the Office of Healthcare Affordability, more affordable for everyone. And part of that is actually also ensuring that everyone's able to pay their share of the costs of healthcare. When we have fewer people insured, then we just see more of this cost shifting, which then tends to drive up costs as well. So let's make government work. That's why I ran for office for the legislature. That's why I'm running for Congress. We can make government work for people. It's not the solution to everything, but it is an important piece of it. And so let's have evidence-based, science-based policies that actually work. Let's get past the political rhetoric and the division so that government will work for people. Because right now what we see federal workers being slashed and burned so that no one's answering the phones if you have a problem with your Social Security. We're seeing a chaotic tariff policy that makes it really hard for small businesses to figure out like how much inventory to maintain and what to buy so that they can continue to operate their businesses. We're seeing food that's not being harvested because of immigration policies that have scared away the workers. And then tariffs, that means that any food that's imported to the US is much more expensive. And you wonder what's going to happen to the food prices, come this winter. Things are too expensive for Californians. Things are too expensive for Americans right now. Why are we making it worse? That's why I'm running for Congress. Healthcare, let's make healthcare available to more people and affordable. Let's make sure that life is more affordable for people. And then ultimately, let's be sure that we have a fair, just government that works for everyone.
Definitely. Thank you for that.
Mhm.
And I guess branching off of that, for listeners who may not be familiar, can you go into what Proposition 50 is and why it matters to
Yes.
voters?
Well, Proposition 50 matters because we need to basically ensure that we have an equal playing field or level playing field in our federal government to be sure we have the appropriate policies addressed. And I need to mention that when I was in California, in the legislature, they basically went through redistricting from the commission. And in fact, I support the independent commission and that politicians should be drawing their own lines. But the problem is that politicians in Texas and many other states, at the behest of the president, are drawing their own lines. They're drawing their own lines to deprive voters in their own states the opportunity to have a say. I do need to mention that here in California, the voters will have the final say. So the voters in Texas never had a say. In California, the voters have the say, and the voters do have a say to say, look, we need to have the kind of representation that will ensure that our state and the people of our state are protected from essentially a federal government that doesn't seem to have any checks or balances on the president when he pursues policies that are harmful to the people who live in our state. You know, when he's trying to send National Guard troops from one state into another state, that should disturb people. That's a problem, right? But there's no one able to call him to account for that because he himself is asking to basically tilt the playing field in his favor. And there are people who have done that, and we need to level out that playing field again. And that's what Prop 50 will do. Prop 50 will basically create that opportunity. The commission still will do its work again, the next census, and they will do their work again. Hopefully, there is a path to a national ban on gerrymandering or independent redistricting commission. But right now, we have a situation where, unfortunately, some states, without any input from their own voters, are basically trying to tilt the playing field in their own party's favor for pure political reasons. And that is unacceptable.
Definitely. Thank you for sharing. And definitely something that's very important for medical
Yes.
students and all of us to keep our eyes on this
Right.
cycle. And pivoting into, again, our target audience, which is our students and up and coming people in health
Yeah.
policy and public policy. So many of our listeners are medical students and early career
Mhm.
professionals who want to
Right.
engage in policy but may not be sure where to start. So, what advice would you give us for finding their entry point in terms of organized
Mhm.
medicine, advocacy, government roles, or
Sure.
even nonprofits, as you shared?
Yeah. So first of all, sometimes people will ask like, well, we're clinicians, right? We see patients, and that is our primary role, right? And to see patients. And I did that throughout my time in the legislature as well. I continued to see patients because it was important to me to understand what was really going on in the front lines. And what I mean by that is that we can sit there in, the state capitol or in Congress, at the Capitol and say we got something done. If it didn't change the lives in a positive way for people, actual people, which we get to see as doctors, right, who are patients, then what have we really accomplished? And to me, that was really important for me as a elected official to take that elected official hat off and to actually help people as a physician and understanding the problems they faced and trying to help them find solutions to that. And I think that's a particular perspective that's really important. That's why I'm glad to see more physicians being interested in being involved in politics and policy, because we do need that perspective. But it's also important that we don't lose connection with that, our patient care experience. In fact, I think this administration is interesting. They have several physicians in leadership roles who don't have licenses to practice in their career. So they have an MD, but I think they're all MDs. I haven't seen a DO that they've appointed. But it's not the MD that matters. It's the perspective of actually seeing patients, having to help individuals and their families to improve their health care. Now, of course, that keeps you pretty busy, right? So that the challenge is, how do you, like in medical students, right? You're going to be busy. You're going to be busier in residency, and then you're going to practice. And right, for early career physicians, are like, oh my God, I'm like drowning in work, right, and so forth. Why do advocacy? Where do you find the time for advocacy? Why do it? Well, the why is that you probably notice that a lot of the problems your patients face you can't solve in the office alone. But the other part of the why is unfortunately too many physicians face burnout is that actually doing advocacy can be empowering, right? Because what you don't want to do is feel like you're helpless, that you can't do anything, right? You're like, my only tools are the ones I have in my office, and they're insufficient, right? So I found that for me personally, but I've also found for other people as well, that advocacy, although sometimes it's frustrating, is generally empowering and gives us a channel for our energies to really help our patients in a more profound way in some ways, in terms of getting to the root issue causes of some of the problems that we see them in our offices or our clinics or emergency rooms for. Now, how do you get involved? First of all, I'd say pace yourself. So there's a couple of pieces of advice I give. So first of all, for sort of younger, medical students, residents, and so forth, I actually recommend that find a particular health policy issue you're interested in. Nothing too big. Don't like all of healthcare coverage, right? But find something and it has to be something you're interested in, and just follow that in detail, right? Just like every month or two, go Google. In old days, you had to go Medline, right? There's no Google, but go to Google and see, has there been a new article about that, right? New research article, opinion article, newspaper article about that topic, right? And just follow it, right? And once you've been following it for a couple of years, you get to be pretty, about it, right? And not just the side that you like, but like all the issues, right? Anything someone brings up. And pay attention to who's writing these articles, because you'll start noticing that the same experts get referred to. And sometimes you might even have a chance to meet some of those people, and as someone who's knowledgeable about what they've written, oftentimes they're willing to share with you stuff. So that's something that I think is that people should do, because it's not too time consuming, and it becomes the model for looking at any other policy, right, as well. So that's how you can develop some policy expertise sort of more informally than just taking classes. In fact, I will share that the policy issue I followed when I was in training was actually the financing of residency education. Sort of an obscure technical policy topic, but it taught me a lot just keeping up with that particular policy. The other thing I would say is really important is to be involved in organized medicine in your medical society. And why? There's several different reasons. One is as you're going along your education, like as a medical student, you get to rotate through like everything, right? I do a rotation in pediatrics, family medicine, surgery, right, psychiatry, etc. And then you go to residency and you have to pick a specialty. And then you're like, okay, around that specialty. And then you maybe do a fellowship in a subspecialty. And then you go into practice, right? So I'm an academic general pediatrician. So my typical day as an academic general pediatrician is, I work with my other general pediatricians. I see my specialty colleagues at faculty meetings. The pediatric surgeons, I kind of communicate mainly by EHR letters or something like that. So sometimes you start developing a bit of a narrow view. But guess what? Every time I go to a county medical society board meeting, to a CMA or AMA House of Delegates meeting, I hear the voices of other doctors, right? Doctors who are not in academics, perhaps in a private practice or a Kaiser, doctors in a variety of different specialties and are facing different things. And I think that perspective is helpful, because actually when you're trying to do even larger policies, even more perspectives, but at least being aware and interacting with people in that way, I think is very valuable in helping your policy thinking. So those would be my two main pieces of advice.
Definitely.
So anyway, yeah.
Let's go into the lightning round then.
Okay.
All right, Dr. Pan, really quick, 5 questions.
Right.
So, are you an early bird or a night owl?
Night owl.
Amazing. Is it weird to wear socks to bed?
Oh, well, hey, if your feet are cold, wear socks. Let's be practical.
Is a hot dog a sandwich?
Oh boy. I don't know. If you want to call a sandwich, it's a sandwich, right? It's a piece of meat between two pieces of bread.
There you go.
But if you want to argue about it, we can debate it. So,
Milk before or after putting in your cereal?
oh, I put it after the cereal.
Most do, most do.
Because it always gets soggy. It sits there, right? So anyway,
We can talk about that later.
there we go.
Then final question, what gives you the most hope about the future of healthcare?
Actually, what gives me the most hope about the future of healthcare is, frankly, all the people who are continuing to enter the field and want to enter the field. That's really important to say, that we have people who want to spend their career helping people.
Definitely.
Right. And so thank you all for wanting to help people, because that makes our society better and stronger and actually a better place to live when we have all of you who actually want to spend your career, your time helping people.
Awesome. Thank you so much for your time. I appreciate it.
All right. Thank you. All
All
right. Take care. All right. Bye.
Thank you for joining us for this episode of The Hub. If you enjoyed this conversation, please subscribe and share it with others who care about the intersection of medicine, policy, and community health. You can find us on Spotify and YouTube. To learn more or get involved, follow us on social media at Health Impact Hub. Until next time, thanks for listening. Music by Drake Maestas.